This is a really timely opportunity to have these discussions because the main provisions in the WellBeing for Generations Act will commence on the 1st of April this year, so we're less than a month off the so it's just going from theory into practice. Hang on the clicker first. Excellent. First job done. So I'm Claire Germain, I'm from the Welsh Government as well. I work in the local government department, and I've been leading on the legislation around public services boards and now lead on the establishment of those boards and bringing them to practice and supporting those boards going forward into undertaking those functions effectively. Before I get into detail of the assessment, it's worth taking a step back around the context of the assessment. So the assessment sits as part of the WellBeing for Generations Act, which I'll call the WFG Act for the rest of this because I keep stumbling over the length of the name. So what the Act does is put a duty on specified public bodies to carry out sustainable development. And that's the focus of improving the well-being of Wales by taking action in accordance with the SD principle aimed at achieving the well-being goals. That's a duty that's put on a number of, 44 individual public bodies. There's also a duty in the Act on certain bodies to act collectively in their area to improve the well-being of their area. So to establish public services boards, building on the previous voluntary arrangements. In terms of the goals, I'm sure you're all fairly familiar with those now, but the Act sets out 7 fairly broad goals that we should all be aspiring to as public services in Wales. And that's the what of the Act. But the Act also has a how element, which is the how should we be doing that? What are the key ways of working that we should be approaching to make sure that we're off in the best way? And that's thinking about the long term, thinking about preventative action. So one of the key links with the Services Act is that kind of combined focus on prevention, also a combined focus on involvement and engagement, that we should be acting as public services with our people we serve rather than doing it to them or for them with good intentions. There's also a great deal in the Act around collaboration, working together as public services, and integration. So integration of services, integration of in a collaborative sense, but also thinking about the goals as a full set and working towards all the goals at once rather than thinking that you're there to work towards a particular goal. So I think one of the first key distinctions between the two pieces of legislation is the definition of well-being. They're complementary, but they're slightly different, and that has a big impact on the assessment that we'll be undertaking. So in the context of the Services Act, that's around personal well-being, individual well-being. In the context of the WFG Act, it's a much broader definition of well-being. It's the well-being of an area. So it's that social, individual well-being, but also the economic well-being of the area, the environmental well-being of the area, and the cultural well-being of the area. And the assessment will be, for the purposes of our assessment, will be on that far broader understanding of well-being. So complementary but distinctive. The second area of key distinction would be that whilst the arrangement that Chris is describing are on LHB level, the public services boards that are established are on a local authority level, so a different geographic footprint for the two assessments and for the two levels of partnership arrangements. So the boards that are being established will be made up of the key public services in each local authority area, with core statutory membership of the local authority, the local health board, the Fire and Rescue Authority for the area, and Natural Resources Wales, to bring in that key environmental element that had been missing in some areas in the past. But also an expectation that those boards will look beyond that to the other partners, such as the police, the third sector, the role that Welsh Government can play in contributing to that agenda, and a huge flexibility to invite anybody else that they think is important to be part of their work who have a public function. So one of the key elements of our piece of legislation is that flexibility for the local areas to decide what's right for them, who's the right person to have on the table, but also what's the right kind of assessment for them, what's the right kind of plan for them. And I think if I leave you one of my key messages would be there's intended flexibility in our Act, an intended lack of prescription around how things are done. We give the broad framework, but it's intended that the areas have flexibility in how they proceed. So in terms of the core functions of these new public services boards, the first of those is what we're here to discuss today, which is around an assessment of the well-being of that area, a clear picture of the well-being of the people in each area in the context of those 4 aspects of well-being: the environmental, the cultural, the economic and the social. The second then is to turn that intelligence into a local wellbeing plan, a plan for the area that sets out the collective priorities of those public services for that area and the steps they're supposed to take to meet those priorities. So the language of the Act, the local objectives. Finally, the boards will be required to report annually on progress towards meeting those objectives, towards the steps they've taken. And evidence will be at the heart of all of these stages. I think that's something that, looking at Jamie in the audience and who'll be nodding vigorously, this is not evidence for the assessment and then it's put aside. We'll be encouraging and expecting the boards to be using evidence and analysis throughout the full cycle of their work and to work it through in more detail. So the assessment in particular. The assessment is to get that clear picture of the well-being of the area. It's going to be key to the work of the boards because a robust, comprehensive assessment will give the board the intelligence they need to know what their local priorities are and to be able to identify and justify what they're focusing on and what they're not focusing on. So it's vital it's accurate, it's vital it's comprehensive, it's vital it covers all four aspects of the well-being of the area. And we think that this is the building block for how those boards will operate and their first key challenge. So what must be in the assessment? Well, the Act does set out some things that must be in the assessment. So there's an expectation in the Act that the assessment will talk about the area as a whole, but also look at communities within that local authority area. So the assessment set out what those communities are. I think one of the first bit of clarification I can make here is that the assessment must cover communities that cover the entirety of the local authority area. So it's not a case that the assessment can pick a couple of areas to focus in on in particular. This is an assessment of the area as a whole, and then it's subdivided into a set of communities that the board will decide appropriate levels of subdistinction for their area. It needs to look in particular at the well-being of people in the area. So we make that distinction, and in the Act we identify certain categories of persons that the board may wish to think of as the focus of that. It's a may, not must, but we'd imagine that looking at the needs of those who care and support, children, those who've been looked after, people with protected characteristics and others would be a natural starting point for the assessment, but the board will have to think about which of those it looks at in particular. The assessment will also need to think about likely future trends, so what the future will look like, again, that long-term approach and not just a snapshot of the now, but thinking more long-term. And there'll be a future trends report available for them to draw on for that. Equally, thinking about the national indicators, what are the national population indicators that are being put in place and how do those link in with the board's intelligence. But it can also include a range of other analysis, so anything else that those boards feel are important to their area and a key part of their assessment. It's not constrained to those key areas. It can go above and beyond. It can cover other areas, it can include other data, it can look at other analysis. It's meant to be a starting point for your assessment rather than the end point of a checklist. In terms of the how, we're expecting the how that the assessment's done to fit in with that sense of the SD principle. So quite a strong emphasis around involvement and engagement. There'll be a range of sources of data and expertise that's available for the boards to draw on, but we're also encouraging and hoping that they draw on the expertise of the people in their areas. What's their views on the well-being of their area? What do they think the priorities should be? So a mix of qualitative and quantitative data we'd be expecting, but not requiring to be part of the approach. There are certain things that the assessments must take account of, must have regard to. One of those is the assessment of care and support needs, and that will be a key part of the wider picture. But they'll also be required to look at a range of other things: childcare provision, nurse supervision, substance misuse, reoffending, climate change area statements. So the Act specifies a number of statutory reviews and assessments. Now that list looks like that list because those are existing statutory assessment and reviews. That doesn't mean that that's all the boards need to look at. That's a starting point of those things that are already in laws reviews. So we're aware that's quite a strong social emphasis in those. We wouldn't expect that to be the full nature of the assessment. We'd expect you to be drawing on any other national, regional or local assessments that exist that could give you that broader understanding of the well-being of the area. But they must draw on those, and that's where we're looking at the work being done in parallel between the two assessments. The work will be done, we expect, in parallel, but feed into two different purposes. And there's nothing that will prevent them being done in tandem. So it's not a sequential feed of work. What we don't have for the assessment is a great deal of prescription beyond that. So we don't have any regulations underpinning the Act around this assessment. As I say, its intention is that it's a flexible approach. So we give you a start of a tennis to the areas it should look at and the kind of things that should be an assessment, but there's no methodology, no toolkit, no no kind of fill-in sheet. And that's because we believe it's important that boards have flexibility in deciding what they think is important to be in their assessment and how that assessment should be approached and structured. That's not saying that we're not more than willing to help the boards think through that approach and encouraging consistency across regions and people work together, but there's nothing that requires an assessment to look a certain way or cover a fixed number of things. Before I get into that support that's available, I think it was worth taking a quick stop and something that I've picked up in conversations with people around the assessments that's caused a bit of confusion. Situation and response analysis. In our guidance, statutory guidance, in our supplementary guidance around the use of evidence, and I know that the work around the toolkit for social services are talking about situation and response. Now, those are different forms of analysis rather than products, and that's the key point I want to make. We would be expecting the boards throughout their life cycle to be thinking about both situation and response analysis in terms of how they undertake their work. We would expect, broadly speaking, that the situation analysis type of analysis feeds into the assessment, and broadly speaking, that response analysis, how do you respond to what we now know about the area, feeds into the local wellbeing plan. So we're not expecting the response to be part of the assessment of local wellbeing. Jamie and I discussed this at length, and we agree that they're not mutually exclusive, and that it would be healthy and good practice if the assessments started to reflect potentially on what the response might be. But we're not looking for you to do it all in one go as two big products in the first assessment. They're two ways of working rather than two products. And I know there's a workshop that Jamie's running later on which will give you much more information around that situation response and how you can draw on it. So before I finish, support is available. We're working on a common data set, and quite similar to the data catalogue that Chris described in relation to the Social Services Act. And I know that Andrew's running a workshop later which will start to unpick what that common data set would look like. We're expecting that to be available around the time that the Act comes into force, so from the point we start thinking in earnest about your assessments. We've just issued statutory guidance. It went live last Thursday. So if you haven't found it yet, it's available on our website. So we've got statutory guidance for public services boards, which talks about the assessment. We've also got the supporting guidance on the use of evidence analysis, which goes into far more detail around how you might approach doing assessment, how you might approach doing the plan, the situation, the response, and how that package fits together. That's also available in the same place on our website. We're also thinking about running workshops later in the year to help the boards on a regional basis to work through what this means for them. And finally, the boards aren't alone because the boards are working together. I've been really pleased to see in the last year since the Act was passed a lot of work locally and regionally between the boards, thinking ahead about how they're going to put your assessment and thinking about how they work together to do that. So quite a lot of work on a combined approach in Gwent, combined approach in North Wales and others, thinking about how they approach assessments and combining the intelligence, combining the expertise and how the assessment could be done, and reflecting the fact that many of the partners are on more than one board, given that consistency of approach that gives that approach. So we're not requiring prescription, but we are encouraging boards to think about consistency and methodology. So in terms of the next steps, as I said at the start, the boards were established 1st of April 2016. So that's when that's the formal go live date for the that's nice noise, formal things. As with the care and support assessments, the cycle for the wellbeing plans and assessments is triggered by the local authority elections. So the elections in 17 will trigger a wellbeing plan, which will in turn trigger an assessment. So in practice, we're expecting that the assessments are published no later than the start of May 2017. And in practice, we're expecting that boards start work on them, well, they've already started, but certainly formally from the 1st of April. Thank you very much.